This is a beginner's guide to occupational therapy, the basic of the basics. First of all, what is occupational therapy? Basically, we look at whatever is difficult for you to do in your life, of the things that you want or need to do. We figure out how to make you do those things better. This is commonly self-care tasks like bathing, dressing, grooming, hygiene, going to the bathroom, putting on your clothes, cooking your meals, doing your hobbies, those types of things. In children, it might look more similar to sensory integration, reflexes, things that will help a child play and be able to coordinate themselves in this world that we live in, and in order to play with other kids and interact with others as well. Which kind of brings up the next point. Who benefits from occupational therapy? Well, the short and the long answer is basically everyone, from infants to the oldest you can get. Every stage of life has something that occupational therapists can work on and improve on. So our role as an OT is to work with the patient or client, whatever you want to call them, as well as other members of the health profession community. Physical therapists, speech therapists, doctors, etc. OTs are going to be working on physical, cognitive, emotional challenges. Basically every part of you that makes you you, we will work on to make you feel more you and be able to be yourself. Part of the reason why it's such a misunderstood profession is because of how vast the variety of placements occupational therapy can be seen. Because we can work with infants, to geriatrics and elderly people, to orthopedic surgeries, to brain injuries, spinal cord injuries, to pediatrics, to self-feeding, basically everything, which means you could find us basically anywhere. You could find us in a school, you could find us in your home, you could find us in the hospital, in the acute part of the hospital, in the rehab setting of the hospital, you can find us in the outpatient setting of the hospital, etc., etc. It can be kind of hard to really grasp the idea of occupational therapy if you haven't really been exposed to it in your own personal life. But for those who have had a stroke, for example, and half of their body isn't working, and the person they live with isn't able to take care of them, then how are they going to take a shower and get dressed and go to the bathroom without any help? So that's where we would come in, teach techniques on how to get dressed when only half your body works, how to take a shower, how to get in and out of the shower, all those kind of things. And that's how we help improve your life. Occupational therapy has been studied and noted to actually prevent further hospitalizations. So it's definitely worth asking your doctor for maybe a consult with an occupational therapist just to see if there's parts of your life that we can get involved in to make you more safe and more functional in your everyday life. So if you're looking into occupational therapy as a profession for yourself, there's so many opportunities in it that the chances that you could find a portion of occupational therapy that is specific for you, that chance is really good. I hope this was somewhat helpful as a beginner's guide to occupational therapy and getting an overall understanding of what it is. Until next time, I'm Dr. OT Guy. I'll see you later.